Laurie Garrett, on that point, the White House staff, not just the political appointees, but the staff, the 150 or more people who work there all the time, the military valet just referenced, cleaning personnel, cooks, all of these people and their families are now more vulnerable because he is back in the quarters, even though they do have a medical facility and he has his own suite of rooms. What are the risks here? And I want to also ask you about the CDC guidelines on a longer distance and infections can be spread by the virus, small droplets and particles lingering in the air. This is what many people are calling a long overdue updated guideline.
Hi, Andrea. I think we need to think of the White House now as being akin to a nursing home, where we see risks from individuals that are ailing and their caretakers, catching virus from them, passing it to the next patient or the next individual down the road. Let's keep in mind that Melania Trump is also an inpatient, if you will, in the West Wing, and somebody is looking after her. Presumably there are medical personnel, perhaps a quite large team behind the scenes in the West Wing. All of this makes for an environment that's very dangerous, especially if the president refuses to wear his mask. He's really seriously endangering others. You know, it's interesting. The CDC released the report you referred to that is about airborne contagion with this virus. It has gone back and forth in many permutations. There's been a lot of controversy about it, but it's out. It's a reasonable report, but a far stronger one, about 47 pages long, was submitted to Angela Merkel's government about a week and a half ago. It goes through in great detail all the different sizes of droplets, from those that you can actually see with the naked eye and those that are microscopic in size, how they move in the air, how they are propelled from one human to another, which are blocked completely by masks, which are blocked, perhaps can get in the sides if the mask is not a snug fit. And the details in the German side are just so superior. They're the kind of thing that any physician, any epidemiologist, any school teacher, any business owner could use as a template to decide, am I creating safe distances between people? One thing is clear. Now, I haven't had as much time inside the White House as you have, Andrea, but I've had time in the White House, and I know a lot of those hallways are very narrow. A lot of the rooms are remarkably small, given the great import of the facility overall. And I think there's quite a number of places in the White House where it's frankly impossible to be 6 feet apart, much less 12 feet. And if people are not going to wear masks, we're going to see continued spread, just as you would in a nursing home.
And in fact, there's an old ventilation system, of course, as well. So you don't have the air circulation or any of the modern systems that you would have hoped for this kind of eventuality. Dr. Hotez, so much concern over how sick the president really is, and I know you're not involved in his case, but there are a lot of questions given how his doctors evaded, at least the White House physician certainly evaded any answers about his lung capacity, the CTC scans or other scans of his lungs, what his blood test showed, the oxygen level, how low did it fall? Did it go below 93? Was it in the 80s? You know, the chest x-rays. What would you want to know about a patient who is leaving the hospital after 4 days, we know had 2 episodes of his oxygen dropping?
Well, Andrea, what we want to know is what actually happened. You know, what we're hearing are 2 very different narratives. We're hearing on the one hand that they were just admitting him to Walter Reed out of an abundance of caution and that he was never very sick. And then at the far other extreme, we're hearing he was quite ill and deteriorating with low oxygenation, with respiratory distress potentially, or periods of respiratory distress and high fever. And it would be nice to know which one of the 2 is more accurate. I suspect that he, reading between the lines and connecting the dots, he was getting pretty ill, and that was what prompted all of the interventions, which included the remdesivir and the dexamethasone, and also very interesting, that monoclonal antibody cocktail. And we know, and we've learned working on coronaviruses for the last decade and others as well, that virus-neutralizing antibodies can make all the difference in terms of whether or not you survive COVID-19. And so given the fact that the Regeneron monoclonal antibody cocktail, as well as others that are going to come online from AbCellera and Lilly and others, that may have been game-changing, and there is the possibility that that monoclonal antibody cocktail saved the president's life. But it's hard to know because it isn't a controlled experiment. It's hard to know if he got better in spite of the antibody or because of it. But I suspect it was the latter. And I'm just so worried that this kind of monoclonal antibody cocktail will not be made available to the rest of the country for quite a while. And we have to focus on that as well.
And
Andrea,
what about the steroid that he was administering?
I think that's a very important point that Dr. Hotez just raised, is that the Regeneron is an experimental protocol, and the average American is not going to have any access to this drug if, in fact, these monoclonal antibodies are the decisive factor in the president's health. And so for him to go out and say, it's really no big deal, maybe I'm immune, but I'm getting over it, people shouldn't be scared of it. Well, the average American is not going to have access to the Regeneron monoclonal antibodies or any other of the various antibody cocktails that are in the R&D pipeline anytime soon. And God knows how much it will cost.
And to the other point, I just wanted to check back with Dr. Hotez as well on the steroid. What concerns would you have about them prescribing that steroid use, which, according to all the guidance we've seen, is usually for very severely ill patients?
That's right. This came out of studies that were done in clinical trials based at Oxford in the UK. And so, again, this tends to make us think that the president indeed was very ill and therefore required steroids, which, again, makes you wonder why they were so quick to get him out of the hospital. That's not consistent either. So there are so many inconsistencies in his care. I mean, clearly, if somebody was ill, required that type of intensive therapy, monoclonal antibodies, the antiviral drug, the remdesivir, the dexamethasone. This is not someone you want to bump out of the hospital just after a couple of days, but somebody you want to monitor for a while longer to make certain that he doesn't rebound. And again, we have the complexity that we don't have much experience giving these medicines together. So how will they interact? So there's so many reasons why he should have remained at Walter Reed for a couple of more days, but presumably he was just very insistent. And the only defense, one of the defense that I can give for the physicians is, the fact that we're all frustrated by the absence of information. My guess is probably the president came down pretty hard on that and insisted himself that he doesn't, that no information get divulged.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.